We took state death data to the experts and asked them some of the questions we've heard from you.
Since yesterday, unfortunately, we received a report of 87 additional lives lost. Fortunately, we're reporting another 105 new fatalities.
Unfortunately, this does include 146 additional people with COVID-19 who have been reported to have died in the last 24 hours.
The numbers are sobering and dizzying.
This is kind of like the fog of war. It's really hard to tell exactly what's happening in the middle of a pandemic.
The state admits it's at the mercy of local officials, including doctors, hospitals, and coroners, for information about COVID-related deaths.
Everybody who has COVID at the time that they die will be counted as a COVID death by the health department because there's no other way for them to make up statistics properly. Almost everyone that has passed away with COVID died largely because of the COVID or because of complications that the COVID may have brought on.
WGN Investigates analyzed state data from January 1st through April 30th. The state says more than 40,700 people have died from all causes. That's 3,896 more deaths than the same time period in recent years.
I think on balance, the number of potentially inflated deaths is far, far outweighed by the number of deaths that we are missing related to COVID.
As of the end of April, the state classified 2,355 deaths as COVID-related. That means there were more than 1,500 additional deaths this year not currently connected to COVID.
Other part of these excess deaths that give me a lot of concern are delayed or deferred care. We've seen a decline anecdotally in patients presenting to the hospital for symptoms of chest pain, heart attack, heart failure, and stroke.
Some have asked whether hospitals are incentivized to classify patients as having COVID. Health experts say while it's true Medicare reimbursements are higher when a patient is put on a ventilator, for example, there's nothing to indicate what would amount to fraud is taking place.
To suggest that hospitals are somehow incentivized to do something that's medically unnecessary, I think is really questionable. And I just don't think that there's any legitimate evidence that this is occurring on any widespread basis.
Health experts say in the months to come, researchers will drill down on every single death, looking to better understand how this pandemic played out.
Whether or not the death count is overestimating or underestimating, it's not going to be by a huge amount, at least not what's happening now. People are still dying of COVID every single day in this city, in this state, and in our country. Lots of them. And this is something that we need to keep an eye on.
One researcher told me states typically take a year or two to release mortality numbers to make sure they've scrubbed all the data for mistakes. Illinois and other states are now releasing their numbers daily in the interest of informing the public about the dangers of this outbreak. Ben Bradley, WGN Investigates.